Let's maybe tell our practitioners about the program. So as we mentioned, it kickstarts on the 8th of May, and our first module is oncology. And our speaker will be Dr. Gareth Bardowell. So maybe you could tell us a little bit more about what we'll be covering in that module.
So practitioners are extremely lucky to have Gareth Bardowell talking to you. So Gareth Bardowell is the president of the South African Interventional Radiology Society. He is fellowship trained in the United Kingdom. He is established in interventional radiology, and I'm pretty sure any of the practitioners from within the Greater Durban region know this name very well. Gareth Bardowell goes without saying, is a mentor to me. He is an extremely brilliant interventional radiologist and a driver of interventional radiology in South Africa. I admire him very greatly. And he has a niche, he has a few niches. I think he's pretty much good at anything, but I think that one of the things that he really likes to do is he is really involved in the oncological aspect of interventional radiology. So interventional oncology, and so people might be like, first we go from what is interventional radiology? Modern healthcare systems have actually moved to interventional oncology, right? So now it's like a super specialty within it. So interventional oncology is the focus of intervention on the treatment of cancer, right? Or the management of cancer-related issues. And I want you to imagine being able to take a catheter and find a tumor in the liver and injecting chemotherapy directly to the tumor, or taking that catheter and then injecting radiation directly to a tumor, instead of having this patient exposed to, radiation, external radiation, or even chemotherapy where they have other side effects that everybody well knows, the systemic side effects of it. This is actually precise targeted therapies with oncological applications, which has evolved rapidly. I mean, we can even talk about, can you imagine using ice balls to destroy cancer? Whether it be in the lung, whether it be in the liver, whether it be in the kidney, it has a wide range of applications.
The ice balls.
The ice balls. So
now you know why you have to take this course.
I mean, my nickname for Gareth is Sub-Zero. So anyone who knows Mortal Kombat, that he's the guy who uses these ice balls to rid patients of tumors without needing surgery. So we can give a small example. If there's a renal cell carcinoma, which we're going to be covering in the module, a renal cell carcinoma with these maybe less than 3 centimeter nodules on the liver, on the kidney, he's able to get rid of that with an ice ball, which is really great. But we don't only use, when I tease him about being Sub-Zero, he says to me, I don't only use ice. I also use fire. So I think just to explain what that is that the fire that he's alluding to is actually the use of microwave ablation, radio frequency ablation. So those are different types of ablative techniques, whether you use it in the lungs, whether you use it in the thyroid, there's so many applications. We're going to go through them.
Will we be going through those?
Oh, absolutely.
Fantastic.
So this is a really exciting thing for patients. For patients going forward, and for practitioners to understand that, there are options out there. These patients don't have to go for big surgeries. Yeah. We can get rid of tumors very quickly and with minimal effort. Yeah.
So I'm just thinking, if you're listening to this and you're a junior doctor, you want to be in this specialty.
Oh,
right?
yeah.
For sure.
Absolutely.
Okay. Just as a final few thoughts, Dale, what do you think practitioners will take away from this course, from this program?
Yeah, I think that practitioners who want to develop and want to understand things from a modern perspective and want to start practicing medicine at the highest level possible. I think all doctors are driven to that sort of, those sorts of goals. You will get the opportunity to be exposed to something that you maybe were not exposed to, depending on where you were trained. It's really quite interesting and fascinating to see what is actually possible. And I think that, the growth and the understanding of the team and the patient-centered approach that interventional radiology uses is something that we want practitioners to understand, that interventional radiologists are not competitors in any field. We work together with clinicians. And this is the reason why all clinicians need to be involved, so that we can understand one another, we can learn from one another, and we can grow, and ultimately our patients will benefit.
So I think that's a really good place for us to finish up for today, Dale, and hopefully we've inspired you to join the program. For people who would like more information, you can go to MedED, www.meded.co.za. You will find the address at the bottom of your screens now. Navigate to the Focus On page or to the radiology page, and you'll see there will be a button for our course. Click on that, add your name to the mailing list, and we'll keep you up to date. At the end of this promotion clip, there will be a QR code. If you scan that in, it'll take you straight to the Interventional Radiology program, which is great, where all the information about the speakers and what we've chatted about will be there. And I think really that's it for us today, Dale, unless you've got anything.
We're excited for you guys to join us.
Yep.
Come through, let's meet, let's talk. It's going to be a great time. So we've got some wonderful things planned up for you guys, and we really want you to learn something. Yeah. And that's the point of this.
Absolutely.
MedEd, medical education, we're here to teach you some things about interventional radiology, and we'll be very excited if you can join us.
So, 8th of May, www.meded.co.za, 15 CPD points, 2 ethics. Don't miss it.
It's money in the bank.